record it to the cloud just. All right, so I'm talking about climate change and cardiovascular disease. This is a combination of some talks I gave, I've been giving over the last few weeks. So just to say, I'm not a climate scientist, but we do practice evidence-based medicine as doctors, and I do occasionally suffer from climate anxiety, and symptoms do include obsessive thinking. So there is significant economic costs as well as the healthcare costs to climate change, including 3.4 trillion loss of GDP by 2070. This is for Australia alone. So whilst we've all been focused on the coronavirus pandemic and have had a bit of cabin fever, climate change is still occurring. So this is, I haven't seen this much rubbish, and this is during lockdown. But more importantly, a study published in August showed that global greenhouse gas levels were highest in 2020, despite lockdowns. And then a study just published last week showed the CO2 in the atmosphere was at its record high this year. And that was because CO2 levels rose despite the pandemic, because trees and oceans have stopped absorbing so much carbon after deforestation and sea temperature rises. So again, whilst we were all worried about coronavirus, there were historic fires burning all over Europe a few months ago, as well as in California and Canada. And places that would normally get quite cold, such as Canada, where I did my training there, and we were getting minus 25, minus 40 degrees during winter. They were having record-breaking heat waves and up to like nearly 50 degrees. And climate change made North America's deadly heat waves 150 times more likely. So I'll be talking quickly about climate change and its effects, how climate change increases cardiovascular morbidity and mortality, some benefits that both benefit the heart as well as the planet, and how we can start up making a difference as well as reducing our own personal carbon footprint. And I did write this article for Australian Doctor. It was published earlier in the year on climate change and cardiovascular disease. So it's quite comprehensive, that article. So I'm just going to briefly talk about what climate change is. It is a change in the pattern of weather and related changes in oceans, land surfaces, and ice sheets occurring over timescales of decades or longer. The greenhouse effect describes how certain gases in our atmosphere increases the temperature on Earth's surface by preventing some of the energy radiating from the planet's surface from being lost into space. Greenhouse gases enhance the natural greenhouse effect by trapping more heat in the Earth's atmosphere than would be the case without human activity, leading to changes in our climate. So this is the natural greenhouse effect, the human enhanced greenhouse effect. Less heat escapes into space, but more heat is re-emitted with more greenhouse gases. So burning fossil fuels releases greenhouse gases, which increases the greenhouse effect, which increases the temperature and causes more extreme heat and changes the climate. So the IPCC report showed our world is facing a climate emergency. The new report was a code red for humanity. It is unequivocal that human influence has warmed the atmosphere, ocean, and land. Humans have caused the world to heat up by about 1.2 degrees. And extreme weather events such as heat waves, heavy rainfall, droughts, and hurricanes are becoming more frequent and more likely as a result of the climate crisis. Global warming would likely to increase by 1.5 degrees by 2030. And back in 2015, the Paris Agreement tried to get all governments to stop warming at 1.5 degrees. Australia has warmed to 1.4 degrees already. Rising temperatures will cause rising sea levels, longer fire seasons, and droughts. And our levels of CO2, as well as methane and nitrous oxide, have been the highest in the last several million or 800,000 years. So just to reiterate, we're actually going to expect 1.5 degrees in the early mid-2030s, despite what we do. So these are different emission scenarios, but despite what we do, we're going to hit 1.5 degrees in the mid-2030s. And a report released last week showed we will hit 2.7 degrees by the end of the century. Again, despite what we do, we need to actually drastically reduce our commitments, our greenhouse gas emission targets. So if we reduce it by 30%, we'll at least reduce get to 2 degrees, to limit it to 2 degrees by the end of the century. But we actually need to reduce our emissions by more than 50% by to get to 1.5, to limit warming to 1.5 degrees in 2030. So in the next 8 years. So global warming has particular relevance to Australia. We know rising sea levels cause coastal erosion. These are pictures from Coogee. So these are storms last year. We had all these diggers because of all the coastal erosion and all the sand buildup. And these are pylons, which are from wharfs that were there like 100 years ago in Coogee that were all exposed from these from the coastal erosion of the storms. We'll all remember the summers, the bushfires from 2019, 2020, and this is all the air pollution that we were exposed to. We're going to get more fires and longer fire seasons, and they'll get worse as well. So cyclones will become more frequent, rainfall events will become more intense, hotter and dry conditions, heat waves will be longer and hotter, higher sea levels, more flooding, more thunderstorms, and more droughts. I'm a big ocean lover, so I'm worried about the coral reefs. 70 to 90% of warm water coral reefs that exist today will have disappeared by the time we reach 1.5 degrees, and at 2 degrees we will have hardly any coral reefs at all. So this is the Great Barrier Reef. So more than 50% of the Great Barrier Reef has been destroyed due to bleaching from unprecedented marine heat waves, but also extreme weather events such as cyclones. It'll cause some tropical fish may migrate to the cooler waters in Sydney, but it'll also cause other things such as irukandji and box jellyfish to also come to our waters. And hopefully nothing will happen to my local friend here, the blue groper. Whoops, sorry. So this is an important slide. So climate change has a number of effects on human health: increasing CO2 levels, rising sea temperatures, more extreme weather, rising sea levels, causes all these effects. So from a cardiovascular point of view, it's the extreme heat and air pollution that increases cardiovascular disease. But as you can see, there's a number of other health issues related to climate change. So we know cardiovascular disease is already a leading cause of death, and climate change, through its association with extreme weather events, particularly heat and air pollution, will further increase cardiovascular mortality and morbidity, particularly those who are older, those with low socioeconomic status, and those with underlying health conditions will be more vulnerable. And what might surprise you is also that the environment is a modifiable risk factor for cardiovascular disease. It's actually ranked number 4th. It's higher than tobacco, high BMI, high sugar levels, and even non-optimal temperature is a modifiable risk factor. So just moving on to heat, we know Australia is getting hotter. We've increased our temperatures to 1.4 degrees since the 1900s. Extreme heat and heat waves are becoming more frequent. And this is just a map of the average temperature last year. And most of Australia was either above average or very much above average. Heat waves increase mortality, including cardiorespiratory mortality and ED visits and hospital admissions. Particularly those who are older and underlying cardiorespiratory diseases are more vulnerable. A cardiovascular event is actually the primary cause of death during heat waves. And this is a great article that Professor Ollie J produced this year, but essentially how we respond to heat, increasing skin vasodilation as well as sweating, reduces cardiac filling. So the heart responds by increasing contractility, increasing heart rate. You have increased, and then if you have a compromise between high cardiac demand and compromised cardiac oxygen delivery, it leads to ischemia and cardiovascular collapse. So there's a lot of studies that show heat waves and high temperatures increase cardiovascular mortality and morbidity. Essentially, ischemic heart disease, stroke, and heart failure mortality increase. Hospitalizations for cardiovascular disease, especially ischemic heart disease and arrhythmias, increase, and increase of out-of-hospital cardiac arrest. The greater the increase in temperature and the more intense the heat wave, the higher the risk of cardiovascular death. And this is all expected to increase with more increasing heat waves and high temperatures. And there's something called an urban heat island effect. So the people who live in urban regions are more vulnerable, and about 90% of Australians do live in urban areas. Air pollution is composed of particulate matter, gaseous components, and semi-volatile liquids. Particulate matter is characterized by its aerodynamic diameter. So this is the size of a human hair. This is the size of fine beach sand. PM 2.5 you'll hear of is it's less than 2.5 microns. PM 10 less than 10 microns, and then there's something also called ultrafine or nanoparticles. PM 10 can penetrate and lodge deep inside the lungs, while PM 2.5 penetrates the alveolar barrier and enters the bloodstream. And the sources of PM and air pollution are fossil fuel burning, industry, wind-blown dust, motor vehicles, airplanes, wood burning, and forest fires. So there are multiple risks of particulate matter on the cardiac system as well as the lungs. But pretty much every single organ in the body is affected by air pollution. So it reduces your thinking, causes depression, inflammatory diseases, liver diseases, kidney diseases, apart from that, heart and lung diseases, but also affects pregnancies and the fetus. So air pollution is a major cause of death. 7 million people die prematurely every year from indoor and outdoor air pollution. That's globally, sorry. And 50% of these premature deaths are due to cardiovascular disease. So 34% from ischemic heart disease and 20% from stroke. In Australia, a recent study showed that 2,616 deaths were attributable to air pollution, to PM2.5 air pollution. And air pollution was the 4th highest ranking, and this is mortality risk factor. And again, this was higher than high LDL, BMI, and sugar levels. And even low levels of air pollution in Sydney are associated with increased mortality. And globally, nearly 20% of all cardiovascular deaths are due to air pollution. If we look at just cardiovascular disease alone, PM2.5 is the most important environmental risk factor contributing to global cardiovascular mortality and disability. It's considered an invisible killer, and both short and long-term exposure to air pollution will increase cardiovascular mortality and morbidity, including MI, strokes, and heart failure. And so this is important. The risk is increased even when air pollutant levels are below WHO standards. So this is the PM2.5 concentration along here and the relative risk of cardiovascular disease. So what was considered even the healthy WHO PM2.5 levels, you still have an increased risk of cardiovascular disease. And so recently, actually only in the last month, WHO actually have revised down their healthy levels of PM2.5 and PM10. So short-term exposure will increase the relative risk of acute cardiovascular events, MIs, hospitalizations, and death from heart failure, stroke, and arrhythmias. Short-term air pollution is also one of the most important triggers for an MI globally. And long-term exposure to air pollution, particularly PM2.5, amplifies these risks, and it increases cardiovascular mortality. The toxicity of PM2.5 does vary depending on its source. So particularly coal is associated with a higher risk of ischemic heart disease mortality, as is diesel traffic. Nearly 300 people die prematurely each year in New South Wales alone as a result of toxic air pollution from the state's 5 coal-powered power stations. Traffic exhaust also increases MIs. It's considered one of the most preventable acute triggers for an acute myocardial infarct. Individuals are presenting with an MI will more likely to be in traffic 1 to 2 hours beforehand in one study. And idling, which is when you just leave your car running, is comparable to lighting up a cigarette next to a non-smoker. And this is a busy slide, but just what I want to point out in here is that air pollution inhalation has both chronic effects leading to the development of cardiovascular risk factors, as well as acute effects leading to multiple mechanisms that cause cardiovascular events. This is a better slide. After inhalation of air pollution particles, there's lung inflammation, unidentified bloodborne mediators, neuroendocrine activation and particle translocation, leading to cardiovascular impairment with effects on the heart, such as arrhythmias, vasculature, such as increased blood pressure, and blood, such as increased coagulability, which all increase cardiovascular morbidity and mortality. And again, a busy slide, but just to show you the sheer volume of effects of air pollution on cardiovascular disease, including cardiovascular mortality, ischemic heart disease, hospital admissions, heart failure, and stroke, blood pressure, diabetes, arrhythmias, and atherosclerosis. But put simply, there's a linear relationship. The higher the concentration of PM2.5, the higher the risk. The lower the concentration of PM2.5, the lower the risk. And some recent studies just to support what I've said, and these were just published in the last 2 months. Heavy and extremely heavy air pollution was associated with increased risk of cardiovascular disease in hospital admissions, and this was in pollution capital Beijing, and they had more than 2 million hospital admissions for cardiovascular disease. A study in Italy showed all types of air pollutants, and not only PM2.5, were associated with an increased risk of out-of-hospital cardiac arrest. And this was a dose-response relationship. An abstract presented in Cardiac Society showed there was a temporal, from Westmead Hospital, showed that there was a temporal relationship between PM2.5 and PM10 exposure 14 days prior to presentation of a STEMI in those with limited risk factors. And then one last month showed long-term exposure to air pollution and road traffic noise increased heart failure incidence. So wildfire smoke is a type of air pollution. It's a complex mixture of air pollution, and we know wildfires are actually occurring more frequently. This is a great video from NASA, which essentially shows that at any point in time in the world, at any point in time, somewhere in the world, there is a bushfire burning. So most studies have shown wildfire smoke increases cardiovascular mortality, as well as increased morbidity and mortality from ischemic heart disease, heart failure, and arrhythmias. And the risks of air pollution and wildfire smoke are actually amplified when you combine it with high temperatures during heat waves. Elderly are particularly susceptible, and smoking also increases the risk. And you guys probably know this, but the leading cause of duty-related death within the fire service is actually a sudden cardiovascular event. Again, a busy slide, but just to show you the number of effects, pathophysiological mechanisms of cardiovascular effects due to wildfire smoke. So a number of Australian studies have shown bushfires increase cardiovascular morbidity and mortality, increased ED visits for cardiovascular disease, increases in out-of-hospital cardiac arrests and ischemic heart disease-related ED visits and hospitalizations, and increases in the number of emergency ambulance dispatches for cardiac arrest, stroke, and chest pain. The smoke from our 2019-2020 bushfires caused our air quality to be many times a hazardous level set by the WHO. It increased deaths, it increased cardiovascular hospitalizations, and it was estimated to increase cardiovascular mortality by 4.5%. And just to reiterate that we are, we might not consider ourselves exposed to air pollution. This is just a color-coded index of our air quality index. But this was in August this year, August 22nd this year. So we were in the red, unhealthy levels. Our PM 2.5 levels were 7 times the WHO exposure recommendations. Other parts of Sydney were actually in the very unhealthy levels. And we were ranked second, tied second in the world in terms of our air quality. And then just on the 10th of October, this was another screenshot I took, parts near Lane Cove National Park, we're actually in the extremely hazardous levels for air quality. So I'm just going to pause there and just let you guys think about this all. I've just told you a lot of information about air pollution. The summary is air pollution kills. It kills a lot of people, and none of us are immune. And just to add to our depression, climate change increases mental health. So not only post-traumatic stress disorder, depression, but also eco-anxiety and anxiety itself. And mental health disorders, we know, increases cardiovascular disease. There's a number of things we can do to reduce our personal exposure to air pollution, including things like wearing a face mask, staying indoors, using an air purifier, avoiding exercise outdoors, not idling your vehicle, using an air quality app. Those pictures I showed you before were from air quality app, and using indoor plants and having a healthy diet. But what I want to talk more about is what we can do both for our heart and for the planet. So these include dietary changes, increasing active transport, changing renewable energy sources, increasing green spaces, and stopping smoking. So plant-based diets have less environmental impact. So agriculture actually accounts for about 15% of Australia's greenhouse gas emissions. Ruminant livestock make up about 70% of this, producing significant methane and nitrous oxide. And it's particularly, particularly beef. Global greenhouse gas emissions from animal-based foods are twice those of plant-based foods. So this is all the animal-based foods, and this is the greenhouse gas emissions from plant-based foods. Beef production does require more land, water, and nitrogen. And a diet rich in plant-based foods and low in animal foods do have less environmental impact and are also healthier. We know about the Mediterranean diet. We know about its heart benefits, but it's estimated to decrease greenhouse gas emissions, land use, and energy consumption compared with the Western diet. And the Eat Lancet initiative recommends large reductions in animal foods and added sugars and points out major health effects, including 11 million deaths annually, as well as positive effects on the environment. So this is a review of what reduces atherosclerosis. So meat, processed meat and unprocessed meat increases coronary artery disease and cardiovascular disease incidence and mortality. And legumes, nuts, vegetables, fruits all reduce coronary heart disease and cardiovascular disease incidence and mortality. So this review suggested eat what's in green. So lots of fresh fruit, vegetables, whole grains, nuts and seeds, legumes, and only have very little red meat butter and very little processed meat. So plant-based diets do reduce cardiovascular risk. Some recent studies showed, for example, this one showed a plant-based diet in young adulthood reduced your risk of cardiovascular disease more than 50% by middle age. And another one from the WHO showed a high adherence to a portfolio diet, which is a plant-based diet to lower cholesterol, also lowered coronary heart disease. Not all plant-based diets are created equal. So obviously those with high amounts of healthy foods will lower your risk. But if you have plant-based diets with lots of refined grains, such as fries, and foods with high sugar, will lead to increased cardiometabolic risk. And I can criticize places like McDonald's. I actually worked there for 10 years. I also did my interventional fellowships in places that had high rates of coronary artery disease, including Canada, which is famous for Tim Hortons and its donuts, as well as heart attack capital of the world, Glasgow, home of the fried Mars bars. So to have a happy heart and planet diet, have a plant-based diet, reduce your reduce meat intake, particularly red meat, limit processed, packaged and takeaway foods. So avoid going to places like the Heart Attack Grill, where you can get a single bypass burger, even an octuple bypass burger, and flatliner fries, deep fried in pure lard, as well as cigarettes. Avoid ultra processed foods, buy locally produced and seasonal, buy organic if possible. And we need to reduce our food waste. So compost your food waste. Food waste goes into landfill and releases significant greenhouse gases. And in our council area, we have something called FOGO, which is also reducing our landfill food waste. Lastly, something I learned recently is about seaweed. So seaweed is more efficient at reducing CO2 than the Amazon rainforest, and is also considered a superfood. So increasing active transport, we know that that's both general and cardiac benefits. If you walk or cycle rather than use your car, it will lower cardiovascular disease and mortality. It reduces obesity. So give your car a day off, as commuting by car is associated with an increased risk of an MI. And obviously using your car less will also reduce greenhouse gas emissions and air pollution, as well as air pollution. And if you can't walk or cycle to work, consider an electric vehicle. And whilst you wait for the prices of electric vehicles to reduce, consider making your own car, like this guy in Sydney. So, and just a combination of number 1 and 2, we need to reduce our food delivery. Apart from the bad health effects of food deliveries, it has a significant carbon footprint. There's just even opening those apps will also emit CO2. There's a significant packaging waste. So all the plastics with all the condiments as well as the packaging. And this is just showing the greenhouse gas emissions with the packaging. And let's not forget the emissions from delivery vehicles. So we need to change all our energy to renewable energy sources, including wind and solar. This will reduce greenhouse gas emissions, improve air quality, and lowers cardiovascular risk. And studies that have in cities that have reduced air pollution also have shown they have reduced cardiovascular events and cardiovascular mortality. And if you can't put solar panels on your roof, you can also change to an energy provider who obtains energy from purely renewables. We need to increase our green spaces. Green spaces have multiple health benefits, including lower cardiovascular disease, mortality, and less cancer. Provides a place for physical activity. And cities that are that have areas of high greenness are associated with lower cardiovascular mortality. They also help to mitigate climate change by providing shade and reducing the urban heat island effect, improves air quality and reduces air pollution, lowers cardiovascular disease rates due to air pollution. We also need to plant more trees, which remove excessive CO2. And also try to grow your own food. And so I just have to show my impressive basil plant, as well as my kale plant. So stopping smoking, that's a bit of a no-brainer. We know it increased risk of MIs and cardiovascular mortality. It has significant environmental impacts, everything from just the growing, so clearing of the trees, manufacturing, distribution, consumption, and post-consumption waste. It produces significant pollution. So one study showed that if you smoked 3 cigarettes in half an hour, it created more pollution than 2002 model car idling for 30 minutes. And my pet hate is cigarette butt litter. This is a turtle made up of 1,000 cigarettes collected in less than an hour on a Florida beach. So there's a lot of things that we can do to reduce our own personal carbon footprint. If you haven't watched Fight for Planet A, do so and try to take the 1 ton challenge. So I've talked about dietary changes, transport changes, so walking to work, conserving energy, switching your electricity off when you're not using it, using renewable energy to power your home, saving water. We also need to reduce our waste, so buying less. So first avoid, reduce, reuse, recycle and dispose last. The fashion industry is a significant greenhouse gas, polluter as well as greenhouse gas emitter. 10,000 litres of water are required to make a single pair of jeans. Producing one shirt has more emissions than driving a car for 35 miles. So we need to reduce our fashion footprint. So essentially, we need to reduce what we call fast fashion. So buy secondhand, you air dry your clothes and shop from sustainable brands is some of the ways you can do this. We need to reduce our air travel, not that we've been able to travel much, but if you do air travel, also carbon offset your air travel. And then lastly, and what's quite important is we need to divest our banking, our super and our investments into companies that do not invest in fossil fuels. A good website for that is marketforces.org.au. So more can be done. And to quote Professor Leslie Hughes from Macquarie University, we need to electrify everything, energy, transport, and manufacturing. We need to power it all from renewables. This could save Australians individually thousands per year. We need to remove all fossil fuel subsidies. So more than $10 billion of taxpayers' dollars per year is going to fossil fuel subsidies. And we need to have no new oil, gas exploration, or coal exploration or infrastructure. And I'd just like to point out our current environmental minister approved 3 coal mines in the last month. So we need to influence government policy. As we know, Australia is doing an absolutely appalling job of our climate change policy. We're ranked last amongst 200 countries. We actually need to get to net zero by 2035 and a 75% reduction by 2030. What Scott Morrison has taken to COP26 is absolutely pathetic. There's a lot of things you can do. You can sign up for things like Climate Act Now, go to Vote Earth Now, which sends a letter to your federal MP, and join groups that are fighting climate change, including Australian Conservation Foundation Climate Council. I'm a member of Doctors for the Environment Australia, and we're doing a lot about the healthcare sector, and Anthony will talk about that in a second as well. So I'm just going to end with, so this is a place, so 11 years ago I lived here, which was around the corner from this place, which is the Scottish Exhibition Centre, which is the host of the COP26. So let's hope all these heads of state actually do something drastic and think about what they're doing. And more importantly, they choose the vegetarian haggis. So climate change is a code red for humanity. It's one of the cardiovascular disease is one of many health effects of climate change. So we are at the end game. If we don't take drastic action to cut our greenhouse gas emissions now, we, our children and grandchildren, will pay dearly for this failure. Thank you, particularly Greta Thunberg, for trying to help save the planet. We can and should try to do this all together, as there is no planet B. Okay, so I'm just going to end here. I'm just going to, sorry, I know it was very, very quick. I'm going to just introduce, so Anthony Hull is a anaesthetist at Bankstown, Concord and Prince of Wales Hospital, but he's also probably knows more about climate change than any politician that I know. So any politician, and actually he knows more about climate change than anyone I know myself. So he's going to talk about healthcare sustainability, which I think is very important.
Can I swap in? Hi, everybody. Thanks for the opportunity to speak at your meeting this morning. Just going to do a quick position change here. Thanks for the introduction, by the way, Fiona. I'm not exactly a climate scientist, just a humble anaesthetist, but I'm going to talk about the healthcare system, climate change, and the health of our population. and the nexus between them that exists, and what we need to do and how we might be able to do it. As soon as I can progress my slides, that is. Okay, so I want to draw a quick parallel at this stage with COVID-19 because it's quite topical, obviously. It's similar to climate change in many ways. It's a major health threat. Both these issues are indiscriminate. One of the threats is actually that they may overwhelm the health system that is actually involved in treating the victims of these phenomena. In the fight against both of them, laggards hurt us all. There's a requirement for coordinated and collective action in order to treat the problems. Unfortunately, they are different in one major way. COVID-19 has a vaccination available. Climate change doesn't. So climate change is a significant health issue, and the healthcare sector is a significant climate change issue. Healthcare professionals have a responsibility and an opportunity to act on and promote the issue. So do we live or agree with the tenets that we should first do no harm and that of evidence-based medicine? I'm sure we do. This is a little simplified diagram that I think is a good way to think of it. The healthcare system affects our health positively. Climate change affects our health negatively. Climate change affects the healthcare system negatively. And unfortunately, at this stage of the game, the healthcare system affects climate change in a negative fashion. I'm going to just allude to fossil fuel pollution quickly again, even though Fiona discussed some of it. The share of global deaths in 2018 directly caused by pollution was 20% or 8 million deaths. It was relative, these effects are relative to the degree of the pollution in each area that is studied. The economic cost in 2018 was $2.9 trillion based on healthcare costs and missed work costs. This is recent research from Harvard University. Greater than 90% of our population globally is exposed to air pollution levels that exceed the WHO guidelines. In Australia, the Australian Institute for Health and Welfare in 2016 calculated the deaths per annum due to pollution at 3,000. In more recent analyses, that sits at 4% of the total mortality count for Australia, and that's 5,700 people per annum. In New South Wales, due to the effects of coal-fired power stations alone, there are several hundred deaths per year. And the healthcare costs nationally, $2.7 billion per annum. This is a big cost and load on our healthcare system. Now, these kids playing cricket in India, I'm sure no one would look at these and think they're all going to be a picture of health in a few years' time, playing in this degree of smog. In many ways, this is not rocket science. So how does our healthcare sector contribute to our GHG or greenhouse gas emissions? Nationally, we contribute about 7% of our total. So I guess we should ask, should we do anything about it? Or who thinks we should do something about it? Well, many people think and have called for change with regards to our healthcare contributions. Most of those calls are from within. For example, the Australian Medical Association, Doctors for the Environment Australia. But there are many other groups who are crying out for change. This is a joint statement from March this year from the Australian Medical Association, calling on the healthcare sector in Australia to reduce its carbon emissions to net zero by 2040, with an interim emissions reduction target of 80% by 2030. Doctors have called for meaningful action on climate change in an open letter to the federal government. Now, you'll see most of the major colleges have endorsed this call. One college that's not here, if you've noticed or not, is the College of Surgeons, and I happen to have it on good authority. That's simply an administrative thing. They were unable to get their paw print on this in time before it was published. These are the colleges that have declared climate change a health emergency. Doctors for the Environment Australia and Australian Medical Association, of course. But me as an anaesthetist, down the bottom here, you'll see ANZCA, that's the College of Anaesthetists, and the College of Psychiatrists. And the effects on mental health of climate change are growing and are quite significant. So it's no surprise that they're there. Now on the left, you've got the little red wave, that's COVID-19. I hope and pray that's already washed over Sydney and we're seeing it recede into the background now. Unfortunately, and I hate to be a pessimist, but the climate change wave is oncoming and ever growing, and that will take a lot longer to wash away. One thing I want to talk about briefly is gas, because it's a little bit pivotal in this whole nexus. Now, it's always been touted as a clean burning fuel. This is an old advertisement. Let's move ahead to contemporary times. And even Instagram seems to have gotten on board with the promotion of gas as a clean burning fuel, and something that we should all get warm and cozy about. Gas is unfortunately a major source of energy for the healthcare sector, and it has a lot of negative implications for the health of our population, as well as being a major driver of climate change. Gas produces significant levels of PM 2.5 and other harmful pollutants. In one meta-analysis, there was a 42% increased risk of asthma symptoms in kids related to the domestic use of gas. And a homegrown study from the University of Queensland showed that domestic use of gas was responsible for at least 12% of childhood asthma. In a peer-reviewed US study, it was shown that exposure to domestic gas pollutants increased the risk of mortality from COVID-19, and very likely even the incidence of COVID-19. In 2020, the New England Journal of Medicine published an editorial recommending that gas appliances be removed from the market, full stop. A physician and epidemiologist with the US Centre for Disease Control, Dr. Stephen Jones, has said just recently, there's no question this issue has been neglected for a long time, with substantial life-threatening risks that can even lead to childhood mortality. And at the UCLA's Fielding School of Public Health, researchers looked at the outdoor or ambient pollution levels that were generated by domestic uses of gas. The healthcare costs associated to these outdoor pollution levels were calculated to be $3.5 billion per year. So there have been research-based warnings about these issues with gas for the last quarter of a century. The California Air Pollution Regulator in 2020 presented evidence that gas stoves harm health and that transition to electrical appliances would result in substantial health benefits. And in California, in the present day, San Francisco and nearly 40 cities and towns throughout that state have mandated that all electric appliances should be used in residential buildings, that is, no gas. So what is the healthcare sector's environmental footprint in Australia, in particular their carbon footprint? As you can see from this pie chart, it's a very, very broad church. There are lots of areas that need to be looked at. The biggest one is that of the public hospital sector, followed by all pharmaceutical use, and then private hospitals come in third at about 10% of the carbon footprint. Within the hospital sector, operating theatres have one of the highest carbon footprints. That's not a particularly proud fact for me, being someone who works in an operating theatre. Now, Southeastern Sydney Local Health District, if you just look up their website, they even give an estimate of their carbon footprint. Their footprint is equivalent to the annual emissions of 35,000 cars on the road every day. I'm going to take a quick look at the carbon footprint of one of the small pieces of the pie, that is pathology testing. If we consider a coagulation profile and look at the carbon dioxide equivalents in emissions from performing that test, we can see that it could propel this car down the road in equivalents for 1 kilometre. This is a 2012 clunker internal combustion engine vehicle. It's my car in a slightly different colour. Imagine how far my car could get with the thousands of pathology tests we conduct on a daily basis in the New South Wales health system, many of which one could argue aren't particularly necessary. Of course, the environmental footprint of our healthcare sector isn't just related to emissions. The pollution, the air pollution that's generated from the energy we use, as we're now aware, kills many people worldwide. We consume 2% of global plastic, and that's increasing by 6.3% per year. Antibiotics are found in 65% of a UK-based study that looked at 711 river sites worldwide. And of course, there's the whole issue of scarcity of resources and deforestation for rubber, which the healthcare sector uses a lot of. Let's focus a little bit closely on New South Wales. We're emitting 6% of greenhouse gases in New South Wales. We're using 4% of the water, and we're producing 8% of the waste. This cartoon I just want to put in here because I quite like it, but it does raise a point. Say we try to green our healthcare sector, and then someone tells us tomorrow climate change was a big hoax. Well, fortunately or unfortunately, there are many, many benefits to greening our healthcare sector, not least of which is an economic benefit. What's happening around the world and what's happening at home? What should be our litmus? I'm going to start by chatting briefly about what's happening in the NHS in the UK. So they've developed in the UK some years ago a sustainable development unit. This was established to help coordinate and measure the healthcare emissions, their decarbonisation, and also to set practical and in particular evidence-based roadmaps for reducing their emissions. As a result of this initiative, England's healthcare sector is actually one of the leading contributors towards the UK achieving their 2050 net zero pledge. The NHS itself has established a net zero emissions target of 0 by 2040. So let's take a little snapshot in time. Between 2007 and 2015, the NHS's carbon dioxide equivalent emissions dropped by 11%, and this was in the face of an 18% increase in inpatient demand. SDU initiatives continue to save over £90 million per annum. Let's convert that to AUD. I'll let you do the math. So as of April this year, there's one little point I'll raise here. It was expected, and I believe this has been achieved, that all NHS organisations would be purchasing 100% renewable energy from their suppliers. I'm not going to go through this in detail. Don't try to read. It's just a little bit of a breakdown of what is happening within the NHS. As you can see, there are lots of categories. And similar to the pie chart I showed early on, in order to reduce the healthcare sector's emissions in a meaningful and significant way, you really have to tackle it from many, many angles. So where has the NHS gotten to at this stage? They were aiming for an annualised reduction of their emissions of 1,260 kilotons of CO2, and they've achieved it. That's the equivalent annually of 1.1 million homes in the UK's energy consumption. With my anaesthetist hat on, here's something relating to anaesthetics that you can find on the greener NHS portion of the NHS website. And this particular person is talking about the contribution of anaesthetic gases. It's estimated to be to attribute 5% of all acute NHS emissions, things like sevoflurane, nitrous oxide, and unfortunately desflurane. Now, I don't mean to be biased, but desflurane, for those in the audience who know what it is probably one of the most evil gases that we can use as an anaesthetist. It's 60 times more harmful with regards to greenhouse gas effects than something like sevoflurane, which is an equivalent agent. Here we go, some education sessions that you could dig up on the NHS website. Nitrous oxide mitigation. Nitrous oxide isn't just used in theatres, it's used in obstetrics, for labour analgesia, of course, and in dentistry. And this looks like a bit of a multidisciplinary panel that they've got. They're even going to have some lunch provided for that one. Don't see that much in Australia anymore, do you? So here we go. What should we do? What can we do? Do we have any guidelines? Well, Doctors for the Environment of Australia have released some time ago a guideline for recommendations for reducing our health sector's emissions and environmental footprint. Required emission reduction targets, according to this, include an interim emission reduction target of 80% by 2030 and net zero emissions to be achieved by 2040. That would be required to keep us in line with the Paris Agreement of no more warming than 1.5 degrees Celsius. Here are some key points from their document. On our current emissions pledges, we're sitting to be on track for anywhere between a 2.7 to 3.2 degree temperature rise. At 3.2 degrees temperature rise, we have an incompatibility situation with human civilization. National and international peak health organisations have urged their respective governments to deliver healthcare sector net zero emissions by 2030. Now I'm going to go to the top right of this slide here. The breakdown of our emissions within the healthcare sector includes those attributable to public and private hospitals' reliance on emissions-intensive procurement, fossil fuel-based energy supply, and pharmaceutical usage. Significant emissions reductions from the sector will also yield economic benefits as well as the wider health co-benefits, which I'm sure we're partly aware of now. They recommend the establishment of an Australian Sustainable Healthcare Unit to mirror something like the SDU within the NHS, which would help us have a standardized and significantly impactful approach. Some other recommendations that we need to implement fairly rapidly would be the change to 100% renewable electricity supply to all hospitals by 2025. No new gas installations or upgrades in Australian hospitals, including new developments, from now. Reduction in healthcare demand by prioritising preventative and primary care. Procurement of medical equipment and pharmaceuticals only from those sources that have low carbon footprints, and reduction in travel emissions through telemedicine on the patient side and electric vehicle fleets for our hospitals, for example, on the staff side. They go on to state, climate change is a continuing public health emergency. It poses unacceptably high risks to our public health. Our healthcare services, unfortunately, are also vulnerable to a range of risks, including an increase in patient demand, threats to our infrastructure, our workforce and supply chains. Yet the healthcare sector itself is still a significant contributor to climate change. I'm going to touch on emissions, scope 1, 2, and 3, which need to be considered whenever we have a conversation about how we can reduce them. Scope 1 emissions are those directly under the control of a healthcare facility, such as natural gas being used as a fuel or diesel combustion in vehicle fleets. Scope 2 emissions are those from electricity produced off-site. And scope 3 emissions are all those indirect emissions, including the full supply chain, for example, to a major hospital. So here we go, the Northern Territory, too hot and heading south, how climate change may drive 1/3 of doctors out of the Northern Territory. So the healthcare sector in Australia can also lead and influence in a greater degree. It employs 1 million Australians. It's a major producer and purchaser of goods and services. It spent an estimated $185 billion in the 2017-18 year, which was 10% of Australia's overall economic activity for the year. And public hospitals on average contribute more than half of the public sector attributable emissions in each state and territory. With regards to our sector's use of renewable energy, on the horizontal axis here, you see all of the states lined up comparatively. Queensland has had some legislative changes implemented, so you can see that their little green bar there, that's representing renewable energy, is actually quite impressive. Pretty sparse along the rest of that graph, though, I must say. This is a bit busy, but this slide just represents or illustrates one point I'd like to make. The approach of the different states and territories to this issue of our healthcare sector's effects on climate change is very, very disparate, and in most cases is actually fairly small as well. We need to up these targets quite significantly. Let's compare ourselves to a similar economic sector. Amongst individual universities like Monash, University of New South Wales and Swinburne, they are buying more renewable energy in their respective states by multiples than their entire respective state public health systems. Economic costs are important. Economic costs of climate change. Those costs are large. Estimated to cost every young Australian around $250,000 over their lifetime. Natural disasters related to climate change, like the 2019-20 bushfires, cost over $100 billion in Australia. Over the next 30 years, it's projected that it will cost our economy at least $1.89 trillion. The cost of the health impacts associated with coal-fired power alone are estimated at $2.4 billion a year in Australia. Why am I concerned about costs? Well, the healthcare sector is a big drain on our budgets. We need liquidity, we need money. In a cost-constrained world, the healthcare sector will undoubtedly eventually lose out. Now, there are some local things that are going on. I want to highlight a few of them. Hunter New England Health is a bit of a standout. They aim to be an industry leader in sustainability, and they're aiming to eliminate their carbon footprint entirely. They want to be carbon and waste neutral by 2030. They've just activated their solar panel array on their rooftop within the last couple of weeks. Based on the statistics that I'm privy to, they're looking at paying off the capital outlay for that solar panel system within 2.5 to 3 years. Every year after that, it's cash positive. So they have a sustainability committee that's been established. In this hospital in particular, anaesthetists seem to have been acting as leaders of change. There are lots of efforts going on at departmental levels in anaesthetics, as you can see here. They've got Bluey initiatives, plastic recycling initiatives, relocating, that is minimising the use of desflurane, reducing volatile anaesthetics in general by minimising the amount that's used with anaesthetics, and KimGuard recycling. Also changing things at a cultural level, promoting individual anaesthetists to analyse their own practice and what they do every day. In the Canberra bubble, there's some pretty promising stuff going on. The largest infrastructure project in the ACT to date is the Canberra Hospital expansion. This hospital will be 100% electrified, that is no gas connections whatsoever, and it will be run on the ACT's what's soon to be 100% renewable electricity grid. Now, all public buildings in the ACT are looking to be regulated to move in this direction as well. No gas connections. They're also making moves with regards to gas in the domestic sector. They're aiming to be basically a 100% electrified territory. We're even looking at measuring the carbon costs of what they import into the territory. The Adelaide New Women's and Children's Hospital, for those who aren't familiar with it, it's probably going to cost in excess of $1.9 billion. It's a massive new healthcare infrastructure project. From the ground up, from the design stages, this hospital has been designed with sustainability front and centre. This will be a 100% electricalised or electrical hospital with no gas connections once again. Their grid will be powered by 100% renewable energy in South Australia by 2030. It's been designed for waste minimisation, for capture and storage of water to minimise water wastage. And importantly, it's going to be designed with resilience in mind, taking into account the effects of climate change on affecting our healthcare sector infrastructure as time goes on. This is a little shot of some anaesthetic plastic waste. This is from St. Vincent's Hospital. These components are recycled into components for wind turbines in Orange, New South Wales. They're also going to start running a pilot of this soon, I believe, at the Southwestern Sydney Local Health District. Prince of Wales Hospital, where I also work, they've got a sustainability committee that's been set up and a sustainable anaesthesia program. I'm not going to go through the details. I'm aware we all need to go to work and do something active with our day. At the bottom, though, I will note they've got, as part of their waste disposal program, PVC recycling. Here we go. Here's a flyer for that. This particular program, run by Baxter, has been rolled out to more than 55 hospitals across Australia and New Zealand. Now, under the bigger picture here, once again at the bottom part of this slide, they're discussing and considering their power sources at the hospital. If you change from disposable materials in a theatre environment, for example, to reusable, the potential is great to reduce your carbon footprint. The more renewable energy in your mix, however, the greater is that benefit. The new hospital development of Prince of Wales has got a solar panel array planned for its rooftop that will be embedded. Here we go, an education-based flyer from the committee there at Prince of Wales. A little drop-down list here of easy actions to take, prompting people, education sessions. One thing that I'll note here, and again with my anaesthetic hat on, that anaesthetic gas emissions are responsible for 0.1% of all greenhouse gas effects. Blueys, a little education program on how to reduce the use of blueys in theatres. For those who are familiar with them, they'll probably see how often they're used and wasted. They get used for just about everything. So there are a whole lot of descriptions here about how you can avoid them, and avoid is the top of the pyramid that Fiona mentioned in her discussion about how to reduce our waste. Yesterday in theatre, I thought, okay, let's do an experiment. I asked a scrub nurse for one of her KimGuards from a clean trolley. I cut them up with my anaesthetic nurse. I told the operating theatre, we're banning blueys for the day. So instead of blueys, we use the cut up KimGuard, which is perfect for this use. That's not my arm, that's not my tattoo, by the way. It worked a treat, and everyone in the theatre were very, very happy indeed with this little initiative for the day. If only we could multiply that to every theatre, in every hospital, on every day. Imagine the impact of one simple thing like that. So finally, I just want to pose the question, can our healthcare sector afford to make the necessary changes to reduce our climate impact? If you look at these pictures that I've included in this slide, you can probably guess which way I'm leaning. A healthcare sector can't afford not to, environmentally or economically. It's a no-brainer. Thank you very, very much for your time. I know you are all very, very busy. If there's anyone who has a question or any comment, please, and you have time, please offer it.
Well, my main comment is thank you, both of you, for an absolutely amazing talk. Really, it was just so impressive. And I'm sorry we can't get more, the perennial struggle of getting people here on a Wednesday morning, but it was absolutely outstanding and full of so much information. I guess, look, I've only got one question because seriously, it's so overwhelming. You could have hundreds of questions, but I was just interested in what your thoughts. One of the things that's come out of the COVID situation is a movement back towards disposables in vast quantities, you know, being able to go and get your coffee in your own cup, all these sorts of things has kind of all stopped.
Yes.
And so in that sense, that's been quite frustrating to see that. And we've seen it in hospitals too, where using twice as many disposables because of COVID. And I don't know that we're going to move away from that. So going forward, that's going to have to be something we think about, like how can we do that better as well? Yeah.
Yeah, I have a small hit list in the back of my mind all the time. COVID has caused that issue, and a lot of environmental programs, even at higher levels of management and within government, have been pretty much waylaid during the process. So COVID's been a major impediment. I think, though, that for me, I take it as a more of a motivating factor once we get out of this problem of the pandemic, to really headlong try to make some change with regards to our reusables versus our disposables. There's a lot of action that could be taken there. And as our grid greens, it will be it's actually one of the most beneficial things you can do in greening our healthcare sector, in particular in those sort of intensive areas like the operating theatres.
All right. I guess that's all. Does anyone have any other questions? Anyone else listening?
Yes, Anthony, could I have one last question before you go?
Sure.
Terrific talk. Thank you.
Thank you.
Oh, can you tell me what the thinking is in the sector about hydrogen gas, which is so often touted as one of the sort of benefits in the future? Is that true?
I'm really, really glad that you have asked this. For example, I think that's in the ACT or South Australia, they are blending 10% hydrogen, or they're planning to blend 10% hydrogen into their main gas network. One of the significant issues with hydrogen and gas, and I think it is very, very promising as we move forward, is that it can be green or blue. Western Australia have a big project being operated by or proposed by Woodside, for example, at the moment, and it's being touted as a great environmental thing. Unfortunately, it's predominantly blue hydrogen. Now, blue hydrogen is hydrogen that is produced by fossil fuel related energy. In other words, it's really of no benefit that I can see at all. However, green hydrogen is the big thing, and that's where renewable energy is used to produce the hydrogen from water. And that hydrogen is then used as a liquid gas, as a liquid fuel for lots of purposes. Interestingly, yesterday I saw a bus company on the Central Coast have just started an initiative to change all of their buses over to hydrogen fuel cell power. So they'll be using green hydrogen. But it is important to make that differentiation between green hydrogen and blue. Blue hydrogen is just another excuse to use fossil fuels. Green hydrogen is really a very promising candidate.
That's great. I learned something then. Terrific.
Terrific. Great.
Cheers.
Thank you very much, everybody. Thanks for your time and thanks for inviting me along.
Thank you very much to both of you. It was wonderful.
Thank you. Okay.
Thank you.
Bye, Maureen. Bye-bye, Catherine.
Bye.